All right, it's Groundhog Day. And welcome everybody and attending the Benton-Franklin Health District Board meeting. It is Wednesday, May 20th, 2026. And we are going to start to call the meeting to order. We're going to item number 2 of the agenda, and that is to review the performance of a public employee, RCW 42.30.110 IEG. And that executive session will be for 20 minutes. To include, go ahead.
Myself, Brandy McNeil, Eric Husselthing, and the board.
All right, thank you. First thing. We're out of executive session. No decisions were made.
I did. Commissioner, I would like to make a motion that the Benton-Franklin Health District extend the employment contract with the parent for another 2 years under the same terms as the current contract.
Second. We have a motion second. Any further discussion? Hearing none. All in favor signify by saying aye.
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 Thank you. And the motion passes. Congratulations.
Thank you guys. Appreciate it. Been a pleasure.
All right, we're gonna go ahead and move down to item number 3, approval of the April 15th, 2026 regular board meeting minutes. Do I have approval for that?
I'm going to go through April 15th, 2026 regular board meeting, regular board of health meeting minutes.
Thank you, sir. Do I have a second?
I second that.
We have a motion second. All in favor signify by saying aye.
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 Motion passes. Going down to item number 4, public comment is available. Do we have anybody online? We'll go with online first that would like to make a public comment.
If you would like to make a public comment and you are online, you can raise your hand inside of the Zoom app, or if you are using a phone, press *9 to raise your hand.
Seeing nobody that's raising their hand online, we'll go ahead and go in the conference room right here. Is anybody in the conference room that would like to make a public comment? Seeing none here, we'll go ahead and move down to item number 5, agency director comments. I'm looking around. Anybody? No takers. No takers today. All right. Unfinished business. Is there any unfinished business? I see nothing underneath there. Perfect. Item number 7, new business. The first one is item number 7A, Office of Health Officer update. And Dr. Krager, you are on.
Good afternoon, everyone. Hope you're all doing well. I'm gonna share my screen. Okay. I have a couple topics. There's been a lot of interesting kind of, I would say, public health news happening. So I want to cover a couple of those. And let's see, actually, I'm just going to do this. So I'm going to talk about hantavirus and Ebola virus. Those have both been in the news. What it means for local public health when those sorts of things happen. And when I talk about a response, I'm not talking about a case, although we could talk about that, but even just someone who may have been exposed and we need to monitor, which is what we've done in the past. And then I think there was a lot of just interesting kind of, reactions to these stories in the news. It got me thinking about kind of how I view those stories and how I approach things, and what I think might be helpful for other people to think about when we see these kind of scary headlines, and how to think about them and process them in a way that makes sense to me. So briefly, we'll touch on hantavirus and Ebola virus, kind of what they are. Hantavirus, there's actually many different species of hantavirus. We have it in the United States, including in Washington, but we only see it with exposure to deer mice locally. So I asked Heather, she couldn't remember the last time we had one in Benton or Franklin counties, but I think Chelan Douglas just had one recently. So it does happen. It's usually like exposure to rodent droppings or urine. People are cleaning out a barn or a room that had a rodent in it, a deer mice, and then they breathe in that virus. It can cause really severe disease. as you've probably heard about, has about a 30 to 40% mortality rate, can progress pretty quickly to kind of your essentially lungs shutting down. Um, so we do see cases again of kind of our local strain of hantavirus, 20 to 40 cases per year in the United States. So it's not like a unknown thing, but it's pretty rare overall. The one we've been hearing about in the news is called Andes. That's the species because it originates from the Andes Mountains. Um, again, I won't go over everything, but there was a cruise ship with 147 people on board from 23 different countries. And unfortunately, there were 11 cases associated with it, although I think I saw one of those got downgraded to, they think it actually wasn't a case, so it might be 10 now. And 3 people have died. Um, as of now, there haven't been any cases of um, this virus being spread beyond that cruise ship, which is good news. I know initially there was concern, that people who had been exposed to sick people on an airplane may have had symptoms, but no one else has developed symptoms. The initial cases were likely infected pre-cruise, maybe in Argentina. Um, and then unfortunately got sick on the cruise and then transmitted it to others. I want to say it's a pretty unique situation. Obviously, cruise ships, we hear about outbreaks and they are kind of a bad place for a infectious disease to happen, right? Especially the one that can spread person to person, sharing a lot of space, you're sharing potentially bathrooms, you're just in close contact with people, you're sharing air systems. All these make for kind of an efficient way to transmit disease between each other. Ebola has been more recent. We've heard about in the last week that there's a significant outbreak happening in the Democratic Republic of the Congo. They think it's been going on for maybe a month or two, but only just began like kind of publicly aware of this happening. But they think there's been about 500 cases and about 130 deaths. Ebola, again, also very severe disease, can about a mortality rate of around 50%, kind of depending on your access to healthcare and that sort of thing. I think it's important to note we're still early in this outbreak. We don't know, where it may go, how it may spread. But I also think it's gotten a lot of news, but we've had much larger outbreaks in the past of Ebola, unfortunately. The largest being in 2014 and 2015, where Sierra Leone, Liberia, and Guinea had thousands of cases, thousands of deaths among those 3 countries. We did see some further spread outside of those 3 countries, but it was eventually contained. So those are things we keep an eye on. And what does that mean for public health? So um, we were also notified that there were some King County residents that were one that was exposed to to ship on the ship to the Andes virus, and then 2 were exposed on an airplane where one of those patients was briefly on an airplane and then taken off. So that means that they were exposed. It doesn't mean they're actual cases. We have not had a case of this Andes species of hantavirus in Washington. And what that means for King County is that they, monitor those people. I think one was still in Nebraska being monitored, but the other 2 being monitored at home. Ebola, we haven't had any known Washington residents exposed. I think there was 1 case in a United States citizen. Um, uh, and so I think my main message for both of these, and we'll talk about it a little bit more, is the risk to the public really is low. I know there's lots of interest and it's interesting to think about and learn about, but we have measures kind of in place, kind of this whole global public health system works together, and we work hard to kind of keep that risk low. Um, so this is kind of what I mentioned before. We would if we were to have someone who, again, not necessarily a case of Ebola or this Andes species of hantavirus, but someone who was exposed. So they were around someone who was sick, had close contact with someone who was sick while they were potentially infectious. We would get notified by the CDC, and then we would, if they were in our jurisdiction, we then monitor them. It's much easier to do that in the past. In the past, obviously you could do phone monitoring, but sometimes you want a more comprehensive check. You may want to do a video. You may want to watch them take their temperature. Anyway, it's kind of a daily check-in. Make sure you don't have symptoms. If you do develop some concerning symptoms, then we'd figure out what to do from there, which would be making sure they're not around other people, which they should be anyway, and then testing them for whatever it is, either hantavirus or Ebola virus or what other other virus we may be thinking of. So that's how it would work, and we have we do this for other things, but obviously we'd be a lot more cautious for one of these really high mortality diseases. We're also really fortunate in that we have a very, I can't remember the level, I get mixed up, but we have a very secure special pathogens unit in Spokane, where anyone that we had like a high enough suspicion could go, and they'd be very contained and well taken care of, and they have incredible procedures. I was able to tour it a couple of years ago, and it was a very interesting place. So again, we see these kind of news stories, and there's a lot of uncertainty. We see headlines, people are posting things on social media, you hear things from friends, rumors get spread. I get asked, I was in an Uber, I got asked, what do you do for work? What do you do for work? And I was like, I work in public health. They're like, what do you think about this hantavirus thing? And I was like, let me tell you. Let me tell you what you think, or what I think. I think what bothers me the most is people that take advantage of that uncertainty, right? I think especially in public health or physicians or anyone kind of in leadership, we speak in sometimes uncertain terms because we don't always know all the answers, right? And then some people will I will say take advantage of that uncertainty a little bit to promote fear or promote something or honestly try to sell something, and that sort of thing really bothers me. I mean, there's always going to be uncertainty in these situations. um, but what I will say, and our kind of my commitment, BFHC's commitment to the public is, we're going to be very clear and direct and straightforward about, what is happening, when you should be concerned, as things change. And things change all the time. I don't have, high, I don't have a high suspicion at all that hantavirus is going to turn into a pandemic. I think that's extremely unlikely. But if that changed, we would let you know. Um, and and we'd be very clear and direct about why we think that might change. And I think, right now our public health systems are working. Again, no one's perfect, but those systems are working in the background to try to keep us all healthy. And I think, local public health is a huge part of that. Um, we hear, about national, state, global public health systems, but most of the real on the ground work happens at a county or smaller level. So, and that's why, I'm really happy to be doing the work that we do. That's all I have today, but I'm happy to answer questions.
Any questions for Dr. Kreger? Seeing none, thank you very much for your presentation update.
Of course.
So sorry, guys. I was trying to turn my watch on silent.
Oh.
I did the opposite.
All right, and I'm trying to read this as I go because I don't have my reading glasses, so everything's really fuzzy. So I'll go and see. We're going down. No, I'm good. We're doing this well. Squint. A community health improvement plan, the CHIP launch, and Sarah Baumgartner will be doing the presentation.
Hello, thank you so much for having me. I'm excited to be here and talk about the chip.
Oops, where is?
Hold on, I'm getting there. Not feel like opening Canva, but here we are. Okay, so my name is Sarah Baumgartner, and I am the Community Health Improvement Plan Coordinator here at Benton-Franklin Health District.
And I believe you've heard from Purnell about the community health assessment process somewhat recently, and I'm here to share about the next step in that process. So, which is the community health improvement plan. Okay. So the Community Health Improvement Plan is basically a 3-year action plan or roadmap for addressing issues that have been prioritized by the community. We start by diagnosing the health of our community using data and listening to people who live here. And that's the community health assessment part of the process. And then while public health can help diagnose the health of our community, we can't fix the things that we hear about alone. That's where the Community Health Improvement Plan comes in. It's basically a collective game plan for building a healthier community. And it's designed to be flexible and adaptable to respond to changing community needs. And BFHD's role is to help bring people together, to identify solutions, to make decisions, and take action to promote health and prevent costly health issues. So we coordinate the plan, but it's really designed to be a community plan. So the CHIP has been the result of months of collaboration with many community agencies. So on the screen, you'll see just some of the agencies that have been a part of the Community Health Assessment and Community Health Improvement Plan process. So how did we actually select the priorities? So using all of the data that we collected from the Community Health Assessment, the CHIP steering committee members took key issues that had been identified and prioritize those issues based on 3 criteria. So effort, feasibility, and capacity. And then the final priorities were selected after further conversations with partners and experts about where we could make real progress in the next 3 years. So what are the priorities? So our priorities over the next 3 years in the CHIP are access to healthcare, safe drinking water, housing, food insecurity, and mental health. And based on these priorities, we worked with partners to develop goals, objectives, and work plans for each of these issues. And I'm going to share a little bit about the plan. Okay, so first up, access to healthcare. Our first goal is to increase access to dental care for residents of Benton and Franklin counties. For this goal, BFHD and our partners will be hosting an Access to Care Summit next year to collaborate on real solutions. We're also encouraging local medical providers to participate in the Mouth Matters program, which is a program that integrates basic oral health prevention into primary care visits. We'll also be educating school nurses and nurses working in jails on oral health screening and teledentistry, as well as supporting individuals re-entering the community after incarceration, since they have some of the highest unmet dental needs. We'll also be looking at local data collection, since one of our key data sources, which is the statewide SMILE survey, that potentially may be going away, and it's one of our best ways to learn about child dental health. For our second goal is to maintain access to healthcare for low-income residents, particularly related to some of the changes that are happening related to Medicaid work requirements and more frequent eligibility determinations. So we'll be working with healthcare partners to share best practices around helping people get enrolled and stay enrolled in health insurance. So for safe drinking water, that's our second priority area. And this work is all about ensuring that we all have safe water to drink and about identifying and protecting our water from contaminants. Our first goal is about protecting public and private drinking water systems from nitrate contamination. And BFHD is going to be doing this through work with local, state, and federal partners on things like groundwater monitoring, combining multi-agency data into a unified data set, and things like identifying nitrate hotspots. Goal 2 is about reducing the risk to our groundwater from on-site sewage systems, which includes things like public education on maintenance of septic systems. Our third goal is about enhancing our ability to identify emerging contaminants in our water. And to do that, BFHD is going to be expanding our laboratory capabilities. Goal 4 is about enhancing our ability to identify or to detect and respond to harmful algal blooms so that we can protect our drinking water systems, which we'll be doing through continued research into cyanobacteria, and working with partners to strengthen our emergency response to harmful algal bloom events. Next is housing. The first goal is about ensuring effective systems among our continuum of care partners for monitoring and implementing the Benton County Local Homeless Plan. This objective is about supporting work that's already happening rather than reinventing the wheel. And the COC is a group of partners and service providers, which includes BFHD, that is designated to coordinate some of the strategies in that plan. And the work of the CHIP is to help support that. Our second goal is about increasing the availability for housing, availability of housing for people who are underserved by the housing market, such as people with low incomes, people in recovery, and others. This work includes supporting recovery housing that's already planned for the Columbia Valley Center for Recovery, and work to identify unmet needs and then convene decision makers and stakeholders to identify how we as a community can respond.
You know, I just gotta make a quick comment on that. You know, we go to these board meetings every month and stuff, and I didn't realize that until here recently, but you'll see a hallway full of people sitting along the wall here and on the other side of the wall. That's not for the health district. That's actually for human services. Actually, that supports everything we're just talking about right now.
Yeah.
I don't know if you know if you guys were aware of that has to do with all the homeless stuff that we get funding from Washington State Department of Commerce, and that's how we get all the funding to do that. But so if you see them all here, that's actually for human services. That's how much of a need it is. You can see it gets packed even on the days that we're here.
Yeah, thanks so much. Yeah, absolutely. Okay, so the next priority area is food insecurity. And our goal is to reduce food insecurity by addressing barriers such as things like transportation and things like having enough volunteers to help distribute food at food banks, for example. Our approach is to bring people together through the Food Access and Security Coalition, which I coordinate. We actually just had our monthly meeting, or our quarterly meeting this morning. And we're actively looking for folks that want to be a part of that work. And lastly, mental health. This is one of our largest priority areas. So based on some of the suicide attempt data that we see, along with conversations with experts, our first goal is to increase community readiness to provide youth inpatient crisis stabilization services. And there is active work right now happening to try to address this need. Our second goal is to increase social support among adults. Of note, the highest number of suicide deaths in our area are among men ages 45 to 54. That's why we're convening a suicide prevention work group. We're also really excited to work with partners to start some support groups for fathers. We have groups for moms, but we don't have groups for dads. We're also supporting training for professionals in perinatal mental health, and we're going to be better assessing needs through data collection. Our third goal is about increasing protective factors for youth. So protective factors are things that protect youth and reduce the likelihood of things like substance use and violence. For example, having an adult in your life who cares about you, like a coach or a teacher. And so to increase protective factors, we'll continue to host the Youth Summit that brings together youth from around our region. We'll also be bringing professionals together later this year to host the State of Our Youth Symposium and share some of the latest Healthy Youth Survey data. And then we'll be promoting existing supports like the June Handspring platform that offers virtual mental health supports, and working with partners to launch a pilot program to address youth gang involvement and violence so that we can help our youth and also make our community safer. Our last goal is to increase mental well-being by improving school connectedness through school attendance, since schools are a really critical place for student learning and support, and community partners are going to be working together to address barriers to kids coming to school and launching a campaign to increase school attendance. So that's all of our CHIP goals and objectives and priority areas. I want to share what's next, but first I also wanted to share some photos from a launch party that we had. We hosted this launch event in April to share the CHIP with our community partners, and we got really great feedback from that event, and we had over 40 people that attended. So what's next? So we'll be starting a quarterly newsletter to be able to share out progress that we make on the CHIP. We'll also be documenting our progress through annual reports, and we'll be hosting steering committee meetings for the CHIP to discuss progress, to problem solve, and to respond to changing needs and opportunities. Because as I said earlier, the CHIP is really about, it's designed to be flexible and adaptable as our community and our needs change. And then we'll also be doing community presentations like the one today. And we'd love it if you would connect us with groups where we can come and share information about the CHIP. And then lastly, to view the CHIP, you can visit bfhd.wa.gov/CHIP. Any questions?
Any questions?
I mean, obviously it says every single point you mentioned are extremely important. In fact, these are not just at the local level, these are at the national level. And no doubt, every point by itself is a project. My concern is, you know, like when you talk about access to healthcare, which our government has been trying to get that done for the last 50 years and failed. When we're putting that as an objective, which is a valid objective, that requires a lot of resources, including manpower, financial resources, and way more sophisticated and complex network, basically. So the question is, are we outstripping our ability or trying to talk about objectives that we may never be able to achieve? I mean, do we have a structure in place, or have we done something in the past similar to this at the Miniscape that actually proven that we can achieve those?
So for the access to healthcare specifically, we have a focused goal around like helping people get access to health insurance. And for that, we've tried to, like, our goal is to maintain access rather than increase, given all the, you know, many things that are happening. And that's where the CHIP is about, bringing people together to do what we can. We can't promise that every person in Benton and Franklin counties will have insurance, but I think the CHIP is about responding to the needs. We've heard that people are really struggling and they need access to healthcare. So even if we can't, you know, solve this issue, I think the CHIP is about doing the best that we can to help our community, and it's about coming together to do that. And so we have folks that are going to be bringing together our health systems like Trios and CADLEC and all sorts of folks to work together, because when we work together, we can get a lot more done than if it was just BFHD trying to do it all on our own. So I can't say that we're going to solve all these things, but at least we want to be responding and supporting our community as best.
I can help a little bit
Okay,
too,
go for
that we absolutely do have local networks that are certified in navigators that are help enroll folks. And so our goal is to work and partner with the rest of those people to make sure we're all moving forward, finding people where they are, making sure we support them with awareness and outreach about the changes to Medicaid. Some of our staff have already had presentations recently. We'll be partnering more. So yes to all of that Sarah said, but to add on to that, there are local systems. We've been building on them for years. And again, having to be responsive and reactive as things change at the federal level and resources change. But right now, as Sarah mentioned, it's about keeping people covered that can be, helping support those navigator resources, helping refer folks and keep them in the care coordination systems that can help. So hopefully that helps a little bit.
And Carla, the rural health transformation work that will be coming.
Yeah, absolutely. There's more resources that are coming
Yeah.
that will, as Sarah mentioned, it's adaptable and flexible, and we can add additional objectives to help to reach those strategies.
Yeah.
Carol, do you have a question?
Yeah, I was just glad to see Sarah at the forum a couple of days ago at United Way, where we talked about homelessness and what to do as a community. I thought Commissioner Alvarez had an excellent suggestion when we came and talked about housing, which was, focus in on certain groups, because the problem is so wide. It seems to me like if we were to focus in on one or two groups that we could make some progress on, where the county has a 5-year homeless plan that I think is really good. I think that there's some solid suggestions in there, but I think it's just so big and overwhelming that I liked your idea of just narrowing down on just a few things. And I'll get on my soapbox again, is I think that there are groups out there that are ready to build some low-income housing, but they don't have the knowledge about where it's permitted. And so I still really think it would be a valuable idea to get in front of the planning departments to
Yeah.
find out where can we put some of these emergency shelters, since there is no emergency shelter in Benton County. Where can some of these facilities be located so that that's not an immediate barrier? When we are ready, if we get a grant, we need to be able to hit the ground running. And I think one of the things that's stopping us is understanding where those properties lie and where we can, start building.
We could probably get Greg Went, which is our community development director, and he'd probably be able to be the person to talk to, him and Damian Hooper, which is our planning manager. Those would be the two to contact at the county.
Greg Went.
Yeah,
Greg
Greg
Went.
Went,
Damien Hooper.
both of them. You're talking, any other questions, comments? So you're talking, I know you're talking about homelessness, and we're addressing that over there at the human services side. We're getting the grants, or we're getting funding from Department of Commerce to do that. And it's a lot of indigent. It has people that have mental health, substance addiction issues as well. I think the recovery center is going to be a big part of that and help that. It's not the whole segment, but it's a segment, right? And I looked at the mental health side of that too. I asked our staff to look into it. I'm looking at the numbers, and I'm looking we have to look at things like that where let's look at a recovery, and I'm thinking a proactive approach as far as, public safety, I would say quality of life, and the whole 9 yards, and everybody's being impacted. So I asked, what is the cost of someone that, if you're looking at mental health substance abuse and they go to the jail, what's the cost at a head per bed in jail? I know what that cost is. What's the cost if they go into the recovery center? Because we're talking about, it kind of all comes together as that segment, right? And if they're insured by Medicaid, Medicare, the cost of the county is zero. It's only when we put dollars in if they're uninsured. And so that was one of the things, what's the cost? Because you have to look at that business standpoint, what's better? And I think the recovery fills a huge gap cost wise. And then I'm looking at recidivism rate. What's the recidivism rate of somebody reoccurring? So I asked, what are the frequent flyers that we know that are incarcerated at our jail? How often do they repeat? What's the odds? What happens in the recidivism rate if someone goes to a 28-day recovery program through the recovery center? It's less. So it's a win-win both ways. So we're looking at those items there. So I think part of what you said between housing, I prefer a more of a laser approach on things, because when you're talking affordable housing, that means so much to so many different people and so many different definitions. I think we can get more done versus a scattered approach. So
that's why that's actually what's in the plan is to focus in, is to do some of that data work and to really understand and try to identify those populations. And so, that is actually what's in our plan. So
there you go.
That's the good news.
So I think we're looking at that. We're looking at those numbers. And I think ultimately at the end of the day, when we look at that as, policymakers and we're looking at our budgets, I think we're getting closer to that, and it made a lot more sense. I think the recovery center on that segment will be a definite good thing. Oh, the other question I asked, because I know I heard that question too, is are we having people being brought in from other counties and stuff? And so I wanted to talk to our human service department. I talked to a bunch of different people on it because they would know, right? You see everybody here lined up when they're setting in for that, and it's actually about 1%. I was shocked. Because they're the ones who are providing the services. So when they find that out, they know. So even that part, so it's really affecting. We're helping a lot of people within the counties. And I think that's a good thing too. I want to appreciate your presentation. We're doing our homework on our side. We're trying to make good decisions on that, and we're getting educated on that. We'll keep on moving forward. But I think we're all working together on the same path.
And Dr.
Yes.
Dr. Bonnie, just what you saw on the screen were goals. The great thing about the plan is we have goals, objectives, strategies, and tactics, that align underneath to get to those specific performance measures, so we can know whether we are making progress.
We're the glue. Actually, one of our goals is to track insurance enrollment and enrollment data so that we can be tracking what those numbers look like over time.
That's important.
Yeah. So and that's one thing that I don't think I mentioned, but is that we have robust performance measures and things for all of our goals, all of our strategies and objectives, so that we can be assessing progress. So.
And one of the things, we had an executive committee here recently where Carla presented on the CHIP. And one of the first thoughts that crossed my mind is like, wow, this is very lofty, right? And how are we going to financially support this? And the conversation centered around historically how public health has worked within the system of systems to convene people together and in some way, shape, or form using our existing work. So we're not taking on additional work right now on top of what we're already doing. But to your point, Dr. Kawandi, we have to get the system and the infrastructure integrated if we really want to shoot higher in the future. And so I nudged, and specifically Eric and Carla know this, is to kind of start thinking for the future about how we can leverage infrastructure and systems differently. So that when we're building out the chip or we're taking a look at our CHA, is how can BFHD respond not in a reactive, but in a proactive. And so we're looking at within that our business systems for the first time to say, hey, you guys are not isolated in what you do for BFHD. What you do can be leveraged for our operational impact. So I think it was just sitting on me as we were moving in the conversation, like we're working on it.
Any other questions? Thank you very much.
Thank you so much for your time.
All right.
I want to add great work to all of them. Like I sat in on the meetings, there's a lot of thought, there was a lot of meetings, a lot of input. They spent a lot of time putting this together, so shouldn't be, undervalued how much work went into this piece that,
Absolutely.
Keep on going forward, moving on. All right, the next one is kind of near and dear to my heart. I remember we had talked about this, and I looked at some connections over there at KPD, and KPD has taken a huge role in this, and I know that I'm part of the Benton County Law and Justice Council. We have all our city attorneys, city managers, mayors, police chiefs, the sheriff's involved with that. And I spoke about that, had you guys do a presentation, and I think this is just growing, and I think it's a good topic. So at this point in time, we'll go down to item C, unpermitted food vendor task force update, and then
Good. You, wait till you hand the flyers out.
All right, so Erin Hockaday, Director for Surveillance and Investigation. I don't have any slides today, but just bringing a really quick update on the unpermitted food vendor situation, those are task force update and some of the other activities that we've been doing recently. The flyer we handed out to you is actually a flyer that we used for the city of Pasco. We spoke at their city council meeting last week, 2 weeks ago, last week, lost track of time. Where we brought them a little bit of an update because we brought them kind of an initial update on the situation in January. And so we've got a little bit of a recap on what we've been doing there. Today in 2026, we've received 37 complaints of unlicensed food vendors. Of those, only two were the taco kind of pop-up vendors. 11 were fruit cart vendors, which you can see kind of on the back of this flyer, an example of what those look like. And all of those other 37 complaints were online home sales, kind of our more typical unlicensed food vendors, event-based unlicensed food vendors that we may run into. So one thing that we are seeing this year, and it's not just unique to us, some of the other counties are seeing as well, is a little bit of a shift towards these fruit carts. Yet we're hearing the same kind of, same sentiment from the workers that we were with the taco vendors. Like, I just got here to the country, I'm just dropped off here, I'm just told to cut the fruit. So we think, we don't know for sure, because that's not really our side to do that criminal investigation. But we do think that maybe they're connected in with that kind of same ring, or at least the same style of vendors from that California syndicate. We did hear, as I had mentioned to you back in the winter, that vendor in California had mentioned they were going to send about 50 carts up to Washington in the spring because Washington was so lucrative and so easy to get around all of our rules. So we think this is the wave of carts that we're seeing. I compared our data to the same time in 2025. So in 2025, at this time last year, we had 31 complaints of unlicensed vendors, so 37 versus 31. Pretty similar, but of those 31 last year, 9 were taco vendors and 5 were fruit vendors. So we're seeing a little bit of a flip-flop in the type of food that we're seeing, but overall staying steady about 7 to 8 complaints of unlicensed food vendors per month. For broader context, our food safety program so far in 2026 has fielded 209 food safety complaints overall. So the unlicensed vendors make up approximately 17% of our complaints, which that's a good chunk of our time. But our food safety program is churning through food safety complaints every day, sometimes 7 to 8 per day. Since our last update, we have had one additional task force meeting with that group that Commissioner Alvarez was mentioning. So we do want to just give an additional plug for KPD. They've been really, really amazing and central in the effort of kind of being a leader in that room in terms of speaking with the other law enforcement, getting them engaged. So the group that has been put together at the end of April, April 30th, we met. We had 5 law enforcement jurisdictions show up. So some county sheriffs, offices, and municipal PDs. We had most of their county or city attorneys show up as well, so they could have kind of side discussions on codes. So they're all sort of looking into their municipal codes to see if there's gaps, if there's areas where they could strengthen their codes to allow their law enforcement a little bit more direct ability to cite these vendors and conduct enforcement independent of the health district. Then Amanda has been amazing at engaging the PIO. So that was kind of that addition to the group in the last round. Was we also engaged all the city and county PIOs, the law enforcement, their PIOs. She held a separate meeting with the PIOs before our task force meeting. And then we've also kind of invited them into the group so we can start addressing that public messaging side of things. So on the back of this flyer, I brought the flyer.
Can you say what PIO is? What's the acronym? I know it's the acronym.
Public Information
There you
Officer,
go.
sorry,
Thank
thank you. We love our acronyms in public health. On the back of this flyer, I brought it, well, maybe it's the front, because it's got a nice little shot of the kind of campaign that Amanda's come up with. So she went through a couple of iterations and really wanted to base this campaign on something with a little bit of positive messaging. Instead of negative messaging, we're coming up with these 4x6 cards. We're going to order them in both stickers and window claims, so they'll be available to our mobile food vendors or any food vendor that wants to put them in either their window or on the outside of their cart or their truck, so we can better identify which vendors are permitted. So we really want to make sure that we're supporting our permitted local businesses, encouraging people to eat and dine at those businesses. And this does happen to also satisfy a Washington State Food Code requirement because that QR code goes to their latest inspection report. So our code requires that restaurants post a link to where you can find their latest inspection report. So it checks 2 boxes for them. You look like you have a question. I can tell.
You got me. No, I mean, if you have a food truck vendor and you give them one of these stickers or cards to put in their window, you answered the question when you said it has a QR code that goes specifically to them, because I was just wondering if there's another way to track it, because they could, what happens if they provide it and sell it to a unlicensed food vendor? Does that make sense?
So yeah, it's not
So that,
foolproof by any means.
but once again, the QR code is that actually for that specific food vendor that you provided?
It goes to our website where we have all of our inspection records.
Okay.
And so then you can
Look
do
it
a quick search.
So you can look it up pretty easy.
Yeah.
Okay.
Yeah, so they wouldn't want to promote it.
No, that's what I wanted to know.
And there are other pieces to this, right? This is one of 2 pieces of documentation that restaurants are required to post. They're also required by state law to post their permit, which is what looks like down here. That actually has to be posted where customers can see it. So in general, as a consumer, you can look for, this one is a requirement. The brand campaign, that's optional, but we really want to provide them something that they can go, hey, we're not associated with these unlicensed vendors that are coming up from out of state, and help them distinguish themselves from those ones that are not.
And then Aaron, I think Carol, do you have a question?
I did. So all of this coordination with local police enforcement is not just about food safety, is it? Or is it also related to the nefarious activities that might be happening at these?
I don't know that I can speak to that, and that I can confirm that, because that's really not our arm. What I will say is at the state level, we're going to have a meeting in June, the beginning of June, where they're finally going to pull in state patrol, the governor's office, some other higher level state partners the intent is to hopefully get them engaged in doing that investigation. There's certainly a lot of rumors going around, the underpinnings of these businesses. We do know they're cash only. We know there's somebody who drives around and collects the cash. We know what we hear, right? We hear from workers that they were trucked here in vans and dropped off and just told to cut the food or make the tacos. So it certainly seems like there's something else going on, but that's really outside of that public health realm. So that's why we're trying to get more law enforcement engaged.
And while I understand public health's role in that, I think it's really helpful though to be more transparent about what is actually happening, because our Rotary Club has an anti-human trafficking campaign. We just had a big event, Shine the Light, on Saturday night. And this area is really famous kind of for human trafficking and incidences of that. So, you know, we stand by as ready partners. We have placed signs at the airport and with the BFHD and the BFT, the transit system, on trafficking signs. So, and you'll see them. So we'd be happy to help in any of that aspect, you know, the public education. But right now, I don't think it's very well known. However, because of our committee work on anti-human trafficking, we have been looking at food vendors at night because we have been noticing unusual activity at certain food vendors. And so I don't know what we should be doing about it, but it just looks kind of sketchy, you know, from that perspective.
Yeah, I may get with you afterwards too. I know there's some other health jurisdictions. I think King County was working also with some anti-human trafficking organizations and having their inspectors bring some information out with them. So if, you know, when they're interacting with the workers, they could hand out some information on human trafficking. But yes, I think that at this point, it appears like all the individual local law jurisdictions are kind of, some of them are engaging, helping with citations in the field and enforcement. But we really need to get those state level agencies involved for that bigger, because it's a multi-state. I mean, this person's out of California, so it's really beyond KPD or PPD, you know, needs to be up higher. So we're continuing that. That meeting's coming up with the state jurisdictions in June, on June 9th. Our group has presented, I alluded to it earlier, we've done 3 city council meetings. So we did Pasco twice. Last night we did the Richland City Council and talked about the issue as well, just to kind of continue raising some awareness about the issue. We heard this morning, KONA News reported this morning that the city of Pasco council members approved the city to spend $70,000 for 2 temporary code enforcement officers for 6 months to address the issue 7 days a week. They also have quite a backlog of code enforcement cases, but they are putting this in as one of their priority items. So there have certainly been some leaders, some law enforcement leaders in that group that are really helping to kind of keep the group together. We planned sort of a collaborative enforcement approach. Every single head of law enforcement agency in that room said, we're going to do the same. KPD said, we're doing this, you know, we're gonna work with public health. We will communicate to them when we get complaints. They can go out independently or with us, and then we can kind of work in tandem. And the others plan to do the same so that we're working in lockstep and not just flushing the issue from one jurisdiction to another. And then Amanda is working with the PIOs. So when we share messaging, they share messaging. When we hear messaging back from the public, that we address it together. And again, on both sides, we're kind of working in tandem. I've been offered support to those jurisdictions who are going to be looking at their codes. And if they want our support with reviewing the food service sections of their municipal codes, then we'll be working with them on that as well. So that's where we're at. A lot of activity, a lot still coming up. Looks pretty much, again, the same as last year, just a slight shift in the type of vendors we're seeing. And our inspectors are out there every weekend, keeping tabs on it. So any other questions?
I have to say too, that this bi-county effort has been really awesome, because I think it's the beginning of something pretty new. And for as long as I've been here, the food safety team has talked about that partnership with law enforcement, because it has been needed. And so we're just really grateful to everyone in the room and to all of our staff. Thank you, Commissioner Alvarez.
This season.
No, it's true. I mean, that's kind of how it started. And so what we're seeing is something as simple as giving law enforcement a 1-pager. So when they go out off hours, when our food inspectors are off the clock, and they take over and help, that process, and then that might be an opportunity for them to give resources. So this is opening the door to something that is pretty incredible. The governor's office is interested in looking at what we're doing here, what Aaron has been leading as a blueprint for smaller communities across the state. So it's kind of fun to be able to track this, but I really think it's just the beginning, and those conversations are being had.
Yeah.
Some of it too, from what I've heard, is it's local. We're trying to make sure that we're keeping the local control here. Once you start adding, you know, federal FBI and other people involved, it starts to get a little bit out of our control. So it sounds like from the governor's office, he's really trying to make sure he's honing in on exactly what we need here. And then that's where the communication is happening, where Aaron's being able to take it to other health districts, because we're so big, to be able to guide that infrastructure there as well.
And I think what we're doing, like you said, Janae, earlier, you used the word reactive. We're trying to go ahead and get a handle on it, be proactive. And I think everybody's on the same side. So we're working on that. I think everybody's working on that really well. And you're gonna cross over from Richland to Pasco. You gotta get over.
Oh, shout out to Kennewick.
That's what I said, Kennewick too.
We need them on their docket.
Yes, we're trying to get on their docket, yeah.
Yeah, so if,
I'll talk to you.
because it sounds like they're coming across state lines, is there at least a chance of federal funding for some of this effort? Because that's beyond state level.
Yeah, that I don't know. I know the initial conversations, like Amanda said, we're trying to keep it within, trying to keep the control within the state. Because early on, when this issue came up, it was, when we were having a lot of kind of unrest, I'd say, at the federal level around immigration, and there were some concerns about bringing in, federal partners because of that. I think that's coordination that's probably going to happen. If it does happen, if the governor's office is engaged, the State Department of Health, some of those state departments. But I do think that's something we should look at. Yeah.
All right, thank you.
All right, thank you.
Thanks. We'll move on to item D, a review approval of resolution 2605 in the matter of an appointment of an interim health officer in times of need.
Yeah. So we actually talked about this back in March when you guys graciously allowed Dr. Krieger to go on his first vacation. But at that time, we were a little concerned about the how long the resolution would be effective for. And so the resolution in your packet has been adjusted to account for a 30-day is the maximum that this would be in effect in the event that Dr. Krieger is out, at which point we would come back to the board for either an extension or alternate solutions for a health officer position. So still naming the same backup health officer based out of Okanagan. And they have a good rapport between the two of them. So if you guys are in support, I wasn't necessarily going to read it again other than to say I've added a 30-day in there, and then if there's any feedback you guys have.
I would move approval of resolution 2605, the appointment of an interim health officer in times of need.
We have a motion. Second that. We have a second. All in favor, signify by saying aye.
Aye.
Motion passes. We'll move on to approval of vouchers. We have a motion that do the vouchers for payment of unit voucher number 26 through 36. How would you guys do the amount? How about that?
So I move that the Board of Health approves the payment of vouchers numbers 30, 2026 through 36, 2026 in the amount of $1,158,949.28.
Leave it to our doctor to get it perfect. Do I have a motion? Do I have a second? And we have a pharmacist for a second. Yes. We have a motion and a second. Any further discussion? Hearing none, all in favor signify by saying aye. Aye. And the motion passes. Looks like our next meeting will be June 17th. And at this point in time, is there any other comments from any of the board members? Any comment from the board members online? Commissioner Diddy or Commissioner Mullen, any comments before we adjourn?
No comment here.
Thank you, sir. Yes, sir.
With some older people in here than me, I was only 4 months old when Mount St. Helens erupted on Monday. I just want to know how old you guys were when Mount St. Helens erupted 46 years ago. Because I was only 4 months old, so I don't remember Mount St. Helens erupted.
So I
46
won't
years
tell you
ago.
how old I was, but I did go out for a run, and my dad didn't live in the greatest neighborhood in Spokane. I got a really serious asthma attack because months after it had
Yeah.
erupted, there was still ash in the.
Cause I still remember that when I was in Idaho, my grandpa,
Got there,
I'm
right.
like 7 or 8 years old. My grandpa's like, well, Will, at least you weren't around when Mount St. Helens erupted when you were only 4 or 5 months old. 'Cause
All
I
right.
guess like even Idaho is getting all nasty.
So my fellow commissioner here, what we're gonna do is we're gonna have carry on this discussion, but what I'm gonna do first is the meeting is now adjourned.